All right. Is your face beginning to sag? Do you suffer from jowls? Droopy jowls. Well, have you ever heard of smartphone face? I wonder if it's because, you got your little BlackBerry or smartphone or whatever, and you're down here like this, and that's causing your face to droop. Listen, a lot of people now think that is in fact happening to them. And so let's put the question now to Dr. Anthony Yoon, who is a very prominent plastic surgeon, board certified. Doctor, thanks for being with us.
Thanks for having me.
Oh, I'm sorry. He's in Detroit. Thank you very much for being with us. Doctor,
thank you.
Do you think this is true? And how many people come to you to say, hey, it's a problem?
Well, it's funny. There's some plastic surgeons who have tried to, I think, establish themselves by making up a term called the smartphone face. And the idea is that people are on their smartphones so much they're kind of looking down at them, and this is causing them to look older. And I'll tell you that phenomenon is not true. There's no evidence to suggest that looking at a phone for so many hours a day can cause you to look older. So I think it's just a fancy little term that some doctors have made up to try to get a little bit of news, like on a show like this. And in reality, though, there's no truth behind it. What there is truth behind, however, is that smartphones are showing people certain types of aesthetic imperfections. And so they're having work done because of how they look on their phones.
Like what kind of imperfections?
Well, there's an interesting phenomenon. Since the iPhone 4s have been available, people are doing FaceTime. So they're doing kind of this type of Skyping over their phone. And when you look in the phone, people find that their chins actually are looking smaller than they thought. And part of it, I think, is when you have a phone and you're looking down, it's the angle at which you look at the phone. And so last year, according to the American Society of Plastic Surgeons, the amount of chin augmentations went up 72%. And we think that this is partially due to the fact of people looking at their images on a smartphone and noticing these types of imperfections.
The other things that people suffer from, let me just go through it: carpal tunnel, repetitive strain injuries, eye strain, neck and back and pain, and so forth. I mean, these are not psychosomatic, right?
Well, yeah. So now, what's more realistic as far as injuries or as far as things that you're going to notice after being on your phone a lot or being on the computer a lot, doing a lot of Skyping, are these other types of real injuries, things like carpal tunnel. If you're on your computer a lot, and as our society gets more and more computer-based, obviously people are doing that. No, that's something real. People are getting headaches, they're getting eye strain.
Right.
Especially now with these phones, with the tiny little letters that you're trying to read, eye strain is definitely an issue. But aging from it is not.
While I have you here, there was a segment I recently saw that talked about an explosion among male patients, men who want to improve their appearances, everything from chin lifts, chin implants, eye lifts, Botox or Restylane or Dysport or all kinds of things. Are you seeing a lot of that?
Yes, and the numbers of men who are having plastic surgery is growing every year. Now, the number of just in general people having it done is growing, but men especially, and there's a couple reasons. I think the main reason is that the treatments that we have now are not nearly as invasive as they used to be. So men are very scar phobic. Men don't want to have scars to be seen because, still having plastic surgery, it's a bit of a stigma still, especially with men in society. So, with treatments like Botox, where you can inject an area, get rid of wrinkles within a week, a perfect treatment for men. We're also doing a lot of other surgeries like eyelid surgery, nose jobs, liposuction with very minimal scars, very minimal downtime. These men are able to get back to work and they're able to look normal without visible scars. And I think that's what's really fueling this increase in men having work done.
Yeah, it used to be just, sort of women were concerned about that sort of thing, and with men, oh, you look distinguished. No, you look old. And so people want to, especially men, want to feel younger and maybe more competitive in their work environment as well. Doctor, thanks very much for being with us. Love to have you come back and talk about this subject a little bit more, about the increased number of men going for the cosmetic surgery. And, you know, my children suggest that to me on a daily basis. Dr. Anthony Youn, board-certified plastic surgeon, thanks very much.
Thanks for having me.